Man, this is Health Talk. Welcome back to today's edition of Health Talk. If you just listened to my introduction, today we are discussing asthma. We're going to talk about the signs and symptoms, complications, and how to manage asthma. The Malume Health Talk platform is your connection to Health Talk. So, Mrs. Kefla, welcome to Health Talk.
Thank you.
Let's start with you, Mrs. Gabler. We are discussing asthma by medical definition. What is asthma?
By medical definition, asthma is a condition that affects the lungs. It affects the airway by making it to swell, and it gets smaller than you are unable to take in air and exhale air. That means the air can go in and come up correctly. It can be caused by several things. It can be caused, sometimes it's caused by genetic factor. That means you get it from your parents. Or if your family line have asthma, you can also have asthma. Sometimes asthma is occur due to environmental factor, which we refer to as allergic asthma. That occur because of triggers. You have the flower pollens, the dust, those things trigger asthma. Sometimes your pets, the cats, dogs, the fur from them also trigger the asthma. Smoke, when you look at environmental pollutants, the smoke, where someone is smoking or you in an industrial area and you have the pollutants coming or the smoke coming out, you can also suffer from asthma. But there are no main cause of asthma.
Is there any relationship between bronchitis and asthma?
Between bronchitis and asthma, there's some similar relationship because bronchitis is the inflammation of the bronchial tree, and in asthma you have inflammation of the bronchial tree also. So there's some relationship.
Okay, thank you so much. Thank you for giving all the difference between bronchitis and asthma because people thought that when you talk about bronchitis, it's the same type of asthma you're talking about, another name for asthma. Okay, let's talk about the different causes that you just mentioned, environmental causes. Is there any other cause or factors that can lead to asthma?
Yeah, there are a lot of causes. Then when I'm talking about the environmental cause, it means change in season. Then when you leave it from the rainy season to the dry season,
Yeah.
that time within the way you have the Hamilton wind, the air is moist and the environment is moody. So you have somebody coming down with asthma because there's allergy. Then some people have asthma is due to food they eat.
Yeah.
There in some cases, and for the triggers, it varies from person to person. Asthmatic trigger varies from person to person. For example, if a person, someone might eat seafood, like the shrimp, the crab, and they might have asthmatic attack. Another person might eat boiled egg, the yolk, and get choked and have asthmatic attack. Someone with common cold can also trigger the asthmatic attack. Stress can also cause asthmatic attack.
Okay. Thank you so much. Thank you so much. So, what do we do if someone have an asthmatic attack? What can we do to help that person?
When someone have asthmatic attack, one of the first things you will need to do, if the person have tight clothing on, you will want to loosen the clothing because in asthma, you will have tightness of the chest as one of the signs and symptoms. The person will also have difficulty in breathing. So you want to make sure that airway is clear and you want to make sure that chest don't have anything tighten it. So you can loosen that clothes or you make sure they have enough air. You make sure that the area they are are not closed off, they have enough air coming in.
Okay.
So they have good ventilation.
Okay. Now let us move to Dr. Kokoya. Dr. Kokoya, are you there?
Yeah, I'm here. Dr. Kokori.
Okay, Dr. Kokori, sorry. We all know that air pollution is detrimental to our health. It can affect the lungs because you are taking air that is bad for the body. Now, Dr. Kokori do max work when it comes to trying to prevent this asthmatic symptom. Let's say there are serious factors involved with asthma, but let's start with the genetic factor. Are you there?
Yeah, so yeah, I'm here. I'm
Okay.
here.
Okay.
So like my colleague said in studio, genetic also play a factor in asthma. So
Okay.
let's say your parents or your sibling they do have this disease called asthma, you are at high risk of getting asthma. Also, if you have other infection like viral infection because they affect the lungs, so you also a high risk of getting asthma too. And I just want to bring up a theory that I read recently on asthma when I was doing a research that has to do with the hygiene theory. The theory says that if a child, if a child that is born and has not been exposed to bacteria during the early age of early years of development, the child does not create the immunity. So because you are exposed to less bacteria, so when you come in contact or you are exposed to trickle factor or you are exposed to asthma, the body is not able to fight this disease. Yes.
Okay.
So genetic does play a role too. And viral infections and also environmental factor, like she said.
Okay, so what are some of these modifiable risk factors for asthma that our viewers and listeners should be aware about?
Yeah, so for example, if you live in a city that let's say it is full of air pollution, like say like the city I'm living in right now, Philadelphia, you're most likely to have dust in your lungs. So dust is something that people overlook, especially in Liberia or other part of the world, but it does play a factor, it does play a role in getting asthma. Another factor would be like maybe you burning grasses. You decide to do agriculture and you get I see a lot of people do this. You burn your grasses in the yard and it pollute toxic air into the environment. And once you inhale those things, you are also at risk of getting asthma. So if you live in a setting where you have a lot of industry, I mean chemicals, industries that they put a lot of pollution of air, you are also at risk of getting asthma.
Okay. Okay, that let me just ask you that before coming back to my instructor in studio. First, they understand the tracker. It is also good to take down notes on trace and almost like reaction or your reactionary steps in order to gain more information. Is that right, Doctor?
I'm sorry, come again?
We need to understand the tracker first. It is also
Yeah.
good to take down notes and trace. You getting me?
Yes, I'm getting you. I'm getting you.
Okay. Like reactionary steps. When you are an asthma patient, it is also good to take down notes and follow your trigger so that you will know exactly what causes the trigger for you.
Exactly.
Okay, then let me ask you the next question. Apart from knowing when an asthmatic attack can happen, it is also important to pay close attention to what can make the trigger worse. Now that Okokoya, as as soon as an asthmatic attack happen, what should be done?
So there are a lot of treatment when it comes to asthma. There are a lot of treatment. There is not a specific or it doesn't have a specific treatment. So one of the when you have like let's say a severe asthma attack, um, There is a drug called the nebulizer. I don't know whether it's in Liberia, but it's in
Nebulizer,
like
we are not allowed to call drugs name, maybe just the classes of the drugs, because we don't want for people to go to the drugstore and then just buy drugs and say, I'm listening to the Mama Lume Health Talk platform. They told me that when I have asthma, I should buy these drugs.
okay. So
Yeah.
this particular class of drug is fall under the bronchial dilator.
Okay.
So when you take that, I mean when you inhale that, it's almost like a liquid. It's in a vapor form. So you inhale it and be able to relax your lungs, your muscles within the bronchial region, be able to relax it so that air can go in and air can come out as well too. So, but they also have the lung treatment drugs, or the lung treatment medication.
Mhm.
Those would be like anti-inflammatory drugs,
Mhm.
anti-cholinergic drugs, and also there are also therapeutic biologic drugs too that you can use. And recently, there is a more advanced drugs. They call it the bronchi. Yes. So it's an instrument that you use, electrolytes to help the lungs or to help the bronchi to relax. So it open up the lungs or it open up the airway so that air can go in, air can come out too.
Okay.
So, but the most common use of drugs is called the bronchodilator
So that let me
that
just
can be
ask you
used.
this question because we don't have much time. We have to open the phone line to encourage call or caller to call and ask their questions or their concern. What can inhaler or nebulizer be used? How can inhaler and nebulizer be used in combination with oral medications?
Yes. So inhaler and nebulizer, I mean the nebulizer or the inhaler is easily it can easily carry because it's almost like it almost in the size of an L. So you can use it in combination with all your lung treatment drugs. Those drugs that are part of the anti-inflammatory group. So you would take that, maybe the doctor will say you would take that once a day. So maybe if you're ready to go to bed, you would take the inhaler or you would take the nebulizer. Or maybe when you go out in public, environment, you'll be able to take your nebulizer, but they can be used in combination or in interchangeably depending on what the doctor advised, or depending on what the doctor tell you to do.
All right, thank you so much. Information. So, Mr. Skipper, you want to add up on the inhaler and nebulizer?
Yeah. In the case of the inhaler, is used, the doctor usually prescribe that for people to use, and it's good to always have it with you. For the nebulizer, we most time it's used in severe cases. When the person have the severe attack and they use the nebulizer to be able to relieve them as soon as possible, as
Okay.
compared to the inhaler.
So the nebul, so you can use all two at the same time.
No, it's not used together.
Okay. Okay, thank you so much. We will get the data back online. You know, we he journey on from way. He said Minnesota, right? Yeah,
No,
Philadelphia,
definitely.
Philadelphia. He joining us from way Philadelphia due to our proper network quality. But we will get him by the line to join us so that we can discuss this important topic. The phone lines are open. The numbers to call and be part of the discussions is 0770-107-107-0886-107-107. So call and give your concern. Call in. Ask all of your questions about asthma, what you want to know about asthma, how can the trigger be, everything that you want to know. So our guest lecturer are in studio to discuss this important topic. The numbers to call is 0770-107-107-0886-107-107. So the phone line are open. You can now call in, give your concern, ask all of the questions you want to know about asthma. So I think we will have to keep the ball rolling until we can get quarters. Oh, we lost that quarter. The number is 0770-107-107-0886-107-107. You can call and ask all of your questions you want to know about asthma. Call. We just lost that caller again. Keep your call coming in. 0770-107-107-0886-107-107. And if you are outside Liberia, in the USA, Australia, Canada, and you want to be part of the discussions, our WhatsApp number is +231-880-571-223. +231-880-571-223. So that's our WhatsApp number. If you are in Liberia, you can call on 0770-107-107-0886-107-107. Call and be part of this educated discussion. Please do not be, as Yuji always say, please do not be call and learn everything about let me see what's going on. Okay. So they'll keep the ball rolling while we be waiting for our callers to join us. Um, Amen. Um. So, Mr. Skifler, let's just keep the discussion running. Is there any first aid treatment for asthma? Is there any first aid treatment for someone with asthma? Let's say someone is visually having an asthmatic attack. What should someone next to them, their relative or loved one, do as first aid treatment? You were saying something first.
Okay. As I was saying before, in the case of someone having a severe asthmatic attack, what the relative can do first is make sure that the person don't have anything tight on them. They loosen all.
We got a call, Mr. Stifler. Good morning and welcome to Health Talk. Lauren Stephanie. Can you please speak louder?
Philadelphia and the lady in studio for the
Okay.
topic on the discussion. It's so interesting that asthma is being discussed today. It is a very interesting topic because we see a lot of people right now coming down with asthmatic conditions, that respiratory disorder, and the management of it is the therapeutic management of asthma is very important because there are thorough protocols in treating asthma, especially looking at the number of episodes that a particular individual has and looking at the and also looking at those zeros of environmental factors that can trigger the condition. So you must be able to bring to the asthma that two things happening. The bronchi there is constricted and there's an inflammation. So for the long-term management, when looking at asthma, we look at the corticosteroids, those steroid drugs that will be able to reduce the inflammation and controlling the particular concentration of the bronchi. You have to look at those beta those beta two drugs, whether it is beta one but for most patients coming down with this particular asthmatic condition, we see them coming down comorbidities with hypertensive condition. So in treating them, and you should be able to look at that a particular beta blocker will definitely affect what they have in the lungs.
Sure.
So you have to go for beta two selective whenever you want to manage a particular patient. So there are more to say, but I want to appreciate the discussion and following the entire program from where I am right now. Thanks to my mama for having this particular discussion this morning.
Thank you so much, Dr. Lauren. That's one of our doctor in Liberia, very smart doctor. He's doing his. Thank you so much. Thank you for being part of this discussion. Thank you. We appreciate it. He at the school of he to talk Latin there. Yeah, he's one of he been on the platform before, so he's very good too. So thank you so much for adding your voice to us in studio. Yeah, Mrs. Kifler, as we were talking
Okay. As I was
on
saying,
the first issue.
the first thing you want to do is to reduce the tight clothing on the person. Then you also want to put the person in a position that it will help the lungs to expand. If the person will lie, then you put them in semi-sitting position. It will help them to breathe properly. Most time you see people with asthma will turn to curve up. They will put another chair in front of them and bend over. It helps to expand the lungs so that they will be able to take in more air because they are fighting to get, because they are shortness of breath. So they have to get in more air as fast as possible. Another thing that you notice that people with asthma always do, they tend to overdose themselves with the medication because they want to have that relief as soon as possible.
We got a call, please. Good morning, your name and where are you calling from?
Good morning. I'm Dr. Boston. So I just want to
You
go through
calling from
my.
where?
I'm calling from the James Dr. School campus.
Okay, you are live.
Okay, thank you. To the people in studio get. I want to say bravo to them. They are doing an excellent job. Okay, but when it comes to asthma, it's a very good topic for that range to be acquainted with because the management can get complicated with some comorbidity because our population here, some people have hypertension, some people have some heart diseases and other comorbidities. So it's good that people be acquainted with those asthmatics or medication because uh, once the person is having hypertension or hypertension, definitely you definitely have to go for a specific drug and you need a skilled condition to be able to carry on things well. So for the guys in studio, I think something is a good topic because there are some other medications that you don't just use like those beta blockers that who have been talking about it. You have to look for him, especially if they are thinking about one of drugs, maybe inhibitor or certain kind of blockers.
Okay.
So it's a good topic on discussion.
Thank you so much. Thank you so much for joining the show. Yeah, Mrs. Kifler.
So as I said, with asthmatic patient, if I say we are also a asthmatic patient, so I will also be, I'm speaking also from the experience.
Okay.
We tend to overdose ourselves with the medication because once you have the difficulty in breathing, you are so uncomfortable that you want to relieve yourself as soon as possible. So you will find out that we overuse the inhaler. Even sometimes we overdose ourselves with the medication, even the steroids. And steroids, you got to be careful how you take them because it reduces your immunity, and which will increase the symptoms of asthma. So
Okay, there are different type or classifications of asthma depending on how often, right, they happen to someone and how bad the symptoms are. Mrs. Kefler, can you please explain this different type of asthma
okay,
and at what point is medication needed?
so when I was talking at the beginning, I talked about the types of asthma. Where we talk about the allergic asthma, and we talk about those are genetic. Now, in the case of allergic asthma, once the allergen is being removed from the person, the person will tend to feel better. So it's good to also be on the lookout for those things that will bring about the asthmatic attack. Then you have the severe cases of asthma. And for the severe cases, those are people that are not using the medication properly. They don't identify the triggers. They will not follow the doctor order or we say the asthma action plan. They are not following that. They are now also monitoring that breathing, because when you are an asthmatic patient, you ought to know your triggers. When do I feel that I'm having an attack? What are those things that bring about my attack? Once you are able to identify those things, it will reduce the symptom.
So I want to know, exercise induce asthma and that or occupational asthma fall under the non-allergic asthma?
Yes.
Oh, okay. Okay. Thank you so much. Thank you so much for that beautiful question. Let us move by to Dr. Kokoli. Dr. Kokoli, are you there?
I'm in.
Now, recent studies have also shown that breathing exercise can help relieve asthma symptoms. Dr. Kokoli, can you elaborate on this more?
So the breathing exercise is I would say is a class of drugs, right? So it is a process in which the patient go out there and you take in, so you exercise. So you exercise or you work out, you take, as you exercise and work out, you take in air into your lungs. And you also exhale uh, air out of your lungs too.
Okay. Hello?
Can you hear me?
Yeah, you're live.
Yes. So that's it for the breathing exercise.
Okay. Thank you so much. Thank you so much. So, Mrs. Gavler, looking at you being an asthmatic patient, what are some of these major signs and symptoms that when you observe as an asthma patient, you need to rush to the hospital?
There are various signs and symptoms of asthma, and you will have the chest tightness, you will have shortness of breath, you will find out the person will even have difficulty sleeping. Then they will hear this whistling sound, which we call the wheezing. When you have that, it's better to go to the hospital, especially if you have taken your medication and you are still experiencing the attack. It's good to go to the hospital right away, because we know asthma causes death, and we know when respiration is compromised, the chance of survival is also slim.
Sure. So if you are listening to us, the numbers to call is 0770-107-107, 0886-107-107, so you can call and be part of the discussion. I also learned that Mr. Skipper, they get mild asthma, they get acute asthma attack, and they get under the signs and symptoms, and they get static asthmatic asthmaticus. Yes, under the signs and symptoms. So you were talking about, okay, we gotta go. Good morning, Yadime. Where are you calling from?
My name is Ruth Then I'm calling from Togo community.
Yeah, Ruth. Welcome to Health Talk.
Yeah, I want to know if asthma can get better. If somebody can ask you.
If asthma can be cured.
Yeah.
All right. Thank you so much. Keep listening to Health Talk
Well,
with
one of
discussing.
those I have asthma.
Oh, okay. Keep listening to Health Talk with discussing. So, Ruth is asking question: can asthma be cured because she is an asthmatic patient?
There is no cure for asthma.
That I
Asthma
mentioned
can
in
be
the introduction.
controlled. And it can be controlled if you know your triggers. And you go by your asthma action plan. That is, you identify those things that will cause trigger. Most people don't identify that triggers. These strong scented soap, perfume, those things also bring about the attack. When you're in a moldy place, dust will also bring about your attack. There are sometimes some people they will start having this itching of throat. If you are sensitive to your asthmatic attack, that's one of the triggers. As soon as you start having the itching of throat, you know there's some cold coming, the common cold, you take your medication right away. It can also prevent the attack from coming. When you find out you are coughing a lot, you as you are an asthmatic patient,
Mm-hmm.
you will also want to make sure that you take your medication
Okay.
and you take it as ordered.
Okay. So can we now can we move to the complications? Can you just tell us some complications of asthma?
For the complication of asthma, it will interfere with your daily activity. You will not be able to do those things that you normally do. It cause reduction in your concentration. You are not able to think properly. You will also have some problem with your lungs because it's more difficult you have in breathing and you have your bronchial all constricted and there are difficulty for air coming in. You have your lungs also having problem.
Okay.
And for the case of status asthmaticus, as you're talking,
Mm-hmm.
that's a state in which a person cannot control the asthma has come to a point that they are, you use the medication is not working, you have to be hospitalized for some time.
Okay. Okay. Thank you so much. Thank you so much for going through this various. So we say asthma cannot be cured, but it can be managed, right?
Yeah.
We say it cannot be cured, but it can be managed. So to reduce the symptoms that result from airway obstruction and inflammations, you can also prevent extra like we talk about environmental factors. Maybe you see smoke somewhere, air pollution. When you know that you're an asthmatic patient, you don't need to be around there. You need to move far away from these places just so your asthma cannot be triggered. So now let us move to the data. Dr. Kokari, are
I'm
you
here.
there?
I'm here. I'm
So
here.
is there anything you want to add up on the management?
Yes. So she was talking about so let me start from asthma is different in a lot of individuals. So the
That we get a
asthma
call. We
woman.
got a call. 1 minute, please. Good morning. Your name and where are you
Okay.
calling from?
Good morning, Moon Jackson from Colin.
Mo Jackson. Welcome to Health Talk.
Yeah, thank you for the program. Thank you for the show. Thank you to your sitting guest. I want to say something before my question.
Okay.
My relative come on attack very well left on asking usually before the marijuana and drink it and gain relief for it. I want to know is marijuana real good to control asthma? And then second, can asthma be transferred? Can asthma be like the caretaker or the person's child?
All right. Thank you so much for that beautiful question. Our studio guest will address that. Okay, that before coming to you, Mrs. Kefler, the caller asked a very sensitive question. He said, colleagues of his or his friends can always come down with asthma and they can boil the marijuana and give it to him and then he can stop. And one thing he want to know is marijuana